This is Dr. Arthur Perry. This is What's Your Wrinkle right here on WOR. And thank you all for listening because I've got a great treat for you. I've got Dr. Leonard Lee up next. He is the chairman of the Department of Surgery at Robert Wood Johnson University Hospital in New Brunswick, New Jersey. He's the chief of cardiac surgery, a superstar on the campus of Rutgers. And I'm so happy to have you. Thanks so much for taking time on your Saturday evening, Dr. Lee.
Dr. Perry, thanks for having me.
It's a real pleasure to speak to you tonight. Now, I want to talk to the audience about what's going on at Robert Wood Johnson University Hospital. If you've been in New Brunswick these days, you know there's an awful lot of construction going on, awful lot of expansion of the hospital facilities. So one of those facilities that is brand new is the Critical Cardiovascular Care Unit. And Dr. Leonard Lee, being the chairman of surgery and the chief of cardiac surgery at Robert Wood Johnson, is here to talk about it. So tell me now, what's so special about this new facility?
Well, we're actually really excited about this new opening. For the past number of years, we've been one of the leading programs in the Northeast, not only for volume, but also for quality. And now we've got this incredible space which will help us deliver better care for our patients. It's roughly 21,000 square feet. It's 24 cardiac intensive care unit beds and separate rooms. It is absolutely state-of-the-art, and we feel that it is the most patient-centric and also provider-centric for our complex heart patients, including heart transplant, assist devices, our TAVR program, and everything else that we do.
And this is such an important thing, and I'm so happy that Robert Wood Johnson now has it. Now, Dr. Lee trained at the great hospitals. He was at New York Hospital. He did a fellowship at Sloan Kettering. So he's been everywhere, and he knows, and I know, that this is a facility that really is world class. So tell us about some of the key features of this new facility.
Sure, and I can tell you, as compared to those other facilities, this is actually the most modern, the most impressive ICU that I've actually ever seen. And for someone who's been around a little bit, I think that's an important thing. So each room is equipped with movable booms so that all the outputs, all the power, all the gas, all the oxygen, et cetera, are in these booms so that nothing is actually plugged into the walls. So as our patients get sicker and sicker and complex and we need more and more equipment in the rooms to care for these patients, nothing is, again, plugged into the walls and everything is out of the way. So we have what is called ECMO, which is a very fairly new program to us. We've had it for about 2 years. It allows us to provide care to critically ill patients with heart failure, lung failure, or both. And there's a lot of support that's needed for these patients, including devices. And these devices can plug directly into these booms. And because nothing is actually plugged into the walls, it allows us to have 360-degree access to the patients. The patient beds are not up against any wall anywhere. They're actually right in the middle of the room. In addition, we have special lights in the ceiling, which are operating room lights that are adjustable, that allow us to then do bedside procedures with all the great visibility and great lights that we have in the operating room.
So you have some outstanding features that make it easier to take care of patients, and that's the key thing. So you were talking about some of the more complex procedures that are being done. Now, Robert Wood Johnson is a center now for cardiac surgery. It's not just a New Jersey center, but a Northeast United States, if not a nationwide center. So what are some of the complex procedures that you're actually doing there that you take advantage of this kind of intensive care unit afterwards?
So over the past 6 years or so, our volume has grown by over 50%. About 6 years ago, our volume was about 950 cases. This past year, we finished with about 1,350 hearts plus 150 what are called TAVR procedures, which is a new way of introducing aortic valves into patients. So if you put it all together, it's about 1,500 hearts that require this cardiovascular care unit. And of those 1,500, of course, we do your standard heart surgeries like coronary bypass surgery and valve replacements, but we also do heart transplants. We do ventricular assist devices, which are pumps to support the failing heart. We talked about ECMO. And so as our patients get older and older, sicker and sicker, they require new interventional therapies that we are now able to provide and then care for them in this ICU.
My guest this evening is Dr. Leonard Lee. He is the chairman of surgery at Robert Wood Johnson University Hospital and at the medical school, which is part of Rutgers now, Rutgers Robert Wood Johnson Medical School. He's the chief of cardiac surgery. This is the guy. He's doing all sorts of cutting-edge research, and we're so happy to have you in New Brunswick. I'm happy to be part of the Robert Wood Johnson family, and thanks again for taking time tonight. So now I understand that when planning this new cardiac intensive care unit, you and your team placed a very strong emphasis on making it more patient and family friendly. Tell us a little bit about that.
So there are a couple things. It's a very family-friendly waiting room. It's fairly large. We have several TVs. We have charging stations for things like iPhones, because none of us can live without our phones these days. And then as far as the ICU itself is concerned, each patient room has floor-to-ceiling windows. We know in healthcare that phototherapy or exposure to sunlight is extremely important to patients' well-being and also healing. So every room has a tremendous amount of light, literally floor-to-ceiling windows. Also, each room has private bathrooms, so every room has its own bathroom for the patient and for the family members. And also, all the glass doors that lead from the ICU room out into the hallway can turn from clear to opaque with a flick of a switch to provide some privacy when things are being done to the patient or for the patient.
That's pretty cool. I like that.
Yeah.
So Robert Wood Johnson has really become, it's transformed over the last 30 years since I've been there, from a relatively small hospital to a powerhouse in the area, in the state, in the Northeast, in the United States. And it's really such a wonderful thing to see it grow. And you are part of that very important cardiac surgery team. And as we talked about, there are so many new procedures being done now in cardiac surgery. I love the new valve that, it's a scary thing. No one has to, anyone who has faced cardiac surgery or who has family members that are about to have cardiac surgery, it's scary. And the procedures that you're developing now, these less invasive or fairly non-invasive procedures, are incredible. Tell us a little bit about that valve for a minute.
Sure. There are actually three ways of approaching valvular heart disease. So for isolated aortic valve disease, there are three approaches. There's the standard heart surgery approach, which is the incision down the middle of the chest. Then we at Robert Wood are one of the few programs in the country that provide what is called minimally invasive aortic valve replacement, which is standard surgical aortic valve replacement, the gold standard, but through a small incision in the right chest, and it is heart surgery, but the patient's hospital stay is short as 2 days.
Wow. And
then finally we have TAVR, a transcatheter aortic valve replacement, which is gaining a tremendous amount of press these days. It is approved. There are two FDA-approved devices on the market that we do utilize. They're both in third generation and soon to be fourth generation devices. And this is a way of replacing the aortic valve through the artery in the groin, much like a standard angiogram or cardiac catheterization would be done. We do it in the operating room in what's called a hybrid room under X-ray guidance, and we feed catheters and wires up into the heart. And we literally push the old valve to the side. We leave it in its place, but we push it out to the side, and we implant the new valve within it. So by providing all three of these approaches to the aortic valve, we are able to tailor the care to the patient's disease as opposed to trying to make the patient fit into one of our treatment strategies.
Absolutely fascinating how this has developed and gotten better and better and safer. Dr. Leonard Lee, I have to say it's a real pleasure speaking with you and having you take time on this Saturday evening. Thank you so much for being at Robert Wood Johnson and being a guest on the show this evening.
Thank you so much. I appreciate it.
All right. And I'm Dr. Arthur Perry. And if you want more information about Robert Wood Johnson and about the cardiac surgery team and the new intensive care unit, go to the website. It's RWJBH. That's RWJBH.org. And you can call Robert Wood Johnson if you have a question, if you want a referral to one of the cardiac surgeons or cardiologists or any of the physicians on staff. The phone number is 888-724-7123. That's 888-724-7123. And once again, the website is www.rwjbh.org.